Right now, many people are dealing with a lot of stress amid the pandemic. We're going to look today at the symptoms that shows that stress is having an impact on your mental health and how you should deal with this. With us today, local physician Dr. Chad Domeng to answer some of those questions. Thank you so much for joining us again.
Good afternoon. Always a pleasure. Thank you.
So right now you've got anxiety and you've got depression related to the fear of COVID-19. But as a doctor, what are some of the signs you're noticing with patients that you can clearly see it's impacting that person's overall health, especially their mental health?
Yeah, it's a big problem. And when you're dealing with mental health, whether as a physician or as a patient, the first thing is you got to get over the preconception that the community has about mental health. Mental health is an illness, no different than diabetes, hypertension, or anything else. But for some reason, our society still kind of puts mental illness in a box. And use the analogy of a diabetic. Think about a diabetic that in a normal world is exercising, eating healthy, taking their medications, so their sugar is under control. Take that same diabetic and feed them sugar all the time, candy, and they can no longer exercise. And think about how out of control the disease process is. That analogy fits perfectly with mental illness. These are people that are dealing with anxiety, depression in a normal world. So imagine when you take this COVID-19 world and they can't hug, they can't kiss, wearing masks, we're not able to have a job, their kids going to school. And people that were otherwise stable are now heightened at a very high level. Can't sleep, my meds aren't working, my pain's worse. It is a very big problem for professionals like myself.
So you're a board certified in neurology and psychiatry. What impact can this pandemic have on people's brains with all of this stress, and would it be permanent?
Yeah, so that's another good question, and another analogy of using something we see in physical manifestation. So think about somebody that's limping for 8 months. They're balancing their gait the opposite direction. So after time, their good side starts to wear out. Their knees, their ankles, their hips, because of that gimp, right? The same thing happens to your brain. So your brain starts to be programmed in an anxiety and stress state. It starts to rewire itself. We see this in MRIs. We see a part of the brain called the amygdala, which is a part that perceives fear, grows. It actually gets bigger in our brain. A part of our brain called the hippocampus, which is part of our emotions and memories, starts to shrink. So concentration, memory gets worse. Your prefrontal cortex, your memory, your executive function, that part of your brain starts to shrink as well. So we see people that are exposed to high anxiety, high stress over long periods of time have higher incidence of long-term depression, have high incidence of dementia. So these are permanent, irreparable damage.
So in addition to trying to visit with a doctor, what are some of the things you can do to try to deal with this daily huge stress?
You know, I teach my boys this every day, mind and body, one and the same. We're so focused as a country and taking care of our health, right? Our bodies, exercising, eating right, all those things. You got to look at your brain as the same thing. You got to do things that make your brain healthy. One thing, plug out every now and then, get out there and enjoy life. Get out there and be in a wilderness and do things that make you happy that you did pre-COVID-19. Go back to that center that we all have and identify what things are causing you these levels of stress. Look at your diet. There are certain amino acids, L-lysine, L-arginine, magnesium, things that if you're deficient in can cause more anxiety and stress. And all of these things that we don't think about have changed in this COVID-19 world. And we need to start really honing in and focusing on our diet, on things that are really, stressing us out, because not only is it causing stress now and leading to a lot of issues now, but as we talked about earlier, these could be long-term effects that you be dealing with for the rest of your life.
Yeah, you may not see it, but you can feel it, and it's just as important as an actual physical wound, what it's doing to you mentally. Thank you so much for putting that all in context. Appreciate it.
Always a pleasure. Thank you.
Thank you.